Welcome to this short presentation about knee osteoarthritis from the Swansea Bay physiotherapy team. We hope to cover the sort of things that are wrong with your knee, why it hurts, and the kind of things that you can do to get better from this, and also to signpost you maybe to a few resources that would be useful for you. The physiotherapists that have been involved in making this presentation are there in this slide: Andrew, Naomi, John, and myself, Damian. We've based what we say in this presentation on the best clinical guidelines that we have available. These come from the National Institute of Clinical Excellence, so the NICE guidelines, and they guide treatment across a range of health conditions, including knee osteoarthritis. We've also seen thousands of patients with knee osteoarthritis over the years, and a lot of those questions that keep cropping up have made their way into this presentation as well. We've tried to answer some of those. The two questions physiotherapists hear most often in clinic are, what's wrong with me and what can I do about it? We'll try to look at the process of osteoarthritis on a physical level, the physical changes that happen to somebody's knee when you have osteoarthritis. Also to think about the consequences of that, how that affects your life and the way that you feel. A second question, what can you do? Well, there's two well-evidenced first-line treatments. That's the things that you would do right off the bat. You can start immediately this presentation finishes. These are weight loss and exercise. The NICE guidelines recommends these. We'll try to signpost you to sort of local resources and internet-based resources that will help you get on with this right from the beginning. Osteoarthritis is essentially joint pain in the knees or the hips or the small joints in the hands typically. This can lead to loss of physical function. For example, it gets stiff and it's difficult to move as easily, or it might feel weak and less able to do tasks or sports that were previously easier. So obviously this can affect people psychologically and emotionally, and fairly commonly reported in the physio clinic are symptoms like loss of sleep or low mood and loss of confidence and self-belief. So these physical and psychological difficulties obviously then can lead to life problems, like it becomes difficult to work for some people or for other people to play sport in the way that they wanted to or that they did before. Now, if you look at a knee with osteoarthritis, scans and blood tests show that there's cartilage loss. That's the lining of the joint that helps absorb shock and provide a smooth movement. There's some bony growth around the joint, and you can detect inflammation in the area that's affected as well. So all of this sounds pretty bad, but actually the scans of healthy people with no pain and no loss of function and no psychological distress, they often show that cartilage loss and inflammation and bony growth can be absolutely pain-free. So they have all the X-ray signs and none of the symptoms. So thinking about those two pieces of evidence, it's fair to say that this picture of a joint reflects a normal process of wear and repair, particularly as it's more common in previously injured knees. So just as wrinkles or laugh lines around your eyes are a pain-free reflection of all the time that's passed, knee changes on an X-ray are simply showing a normal process of change throughout a person's lifetime. More good news is that this doesn't necessarily get worse. It's a process of wear and repair, not wear and tear. Osteoarthritis refers to a collection of symptoms. The most common one is pain around the joint. The usual joints that are affected are the knees, the hips, and the small joints of the hand, and it's very common. Probably one of the leading causes of pain around the world.
When you look at it under X-ray and under MRI or other scans, what we can see is a change in the cartilage, a thinning of the cartilage, not down to bone on bone in the vast majority of cases, but a change in the cartilage, and then the bone starts to change as a result of that. There's inflammation in the joint that we can detect, and inflammation is a healing process. So what you see is a slow and efficient repair process compensating for some kind of trauma. So the joint looks different, and it's behaving differently, which is why most people are in the clinic. But it's not necessarily as a result of aging. It's not necessarily as a result of degeneration. It's usually in response to some kind of trauma. A footballer having an injury to his ligaments, for example. There's a massive variability in how people present to the clinic. It's sometimes a bit painful or a bit stiff, and it can be a lot worse than that. However, when we look at the X-rays and the scans, there's not very good correlation between a severe or a moderate X-ray and severe or moderate pain. So a moderate X-ray could have severe pain, a severe X-ray could have moderate pain or no pain. So pain and the loss of function that results in, and the effect on a person's ability to carry out their day-to-day activities like work and sport, they can be important consequences of arthritis, but they're not necessarily related to the amount of change on the scan. Pain's actually a much more complex process than that, and that's often related to people's expectations and self-belief, their belief in their ability to get things done and complete tasks, and also other things like mood or sleep and the ability to cope. What you're trying to cope with when you have osteoarthritis is a process of wear and repair, normal repair on a knee. This is typically like the wrinkles of time. You know, you see wrinkles on the outside of your skin. Your knee's probably going to change with that, over time. So due to the very loose relationship between X-rays, MRIs, and how people feel when they have osteoarthritis, we don't really need to scan them to diagnose this. There's enough symptoms that we can see in a physiotherapy assessment that can diagnose osteoarthritis effectively. These are things like your age, your type of pain, is it related to activity, and stiffness in the morning in the joint that lasts less than 30 minutes. These things are perfectly adequate to diagnose osteoarthritis. The main symptoms of early osteoarthritis are pain, which tends to be worse when you move your joint or at the end of the day. It tends to be quite tolerable for the majority of the time. There's brief episodes where the pain can be disabling, but that's few and far between in the early stages. There can also be swelling, a soft swelling caused by extra fluid, and sometimes that's warm or hot to the touch. There can be stiffness or clicking or grating. The joint may feel particularly stiff after rest, but normally you can get on top of this with getting moving. It wears off quite quickly, and the creaking and the crunching is a normal symptom for osteoarthritic joints. You shouldn't be afraid to move them. Nothing to be afraid of with clicking and crunching. Probably a worse symptom than this is the muscle weakness that can arise from not wanting to use the joint. The muscles around the joint might look thin and wasted, and that can actually cause you to have difficulty with certain activities, stairs, sports, work. Not being able to use your joint normally, or reduced function, that can also result from a loss of movement. Your joint might not be able to move as freely or as far as normal, or give way because your muscles have weakened, or the joint has become less stable. Exercises to strengthen your muscles can really help to prevent this. Now, all of these symptoms can be variable. They can come and they can go. Good days, bad days. They can be influenced by changes in the weather, loss of sleep, changes in mood, as we said said before. The main symptoms of osteoarthritis are initially pain, which tends to be worse when you move your joint or at the end of the day. Usually this is tolerable. There's more brief episodes where the pain can be disabling. Swelling is quite common. It's a soft swelling, and that's caused by extra fluid from inflammation. Sometimes that can be warm and hot to the touch. The joints can feel stiff after rest particularly, and that normally wears off quickly as you get moving. They also can sound slightly different. It might creak or crunch as you move, but this is really normal, and you shouldn't be afraid to move a creaking or clicking joint. More problematic can be your muscles. If the muscles become weak through lack of use, they can start to look thin and wasted, and that can cause difficulty with certain activities, going up and down the stairs, getting on and off the toilet or in and out of a chair. This can have a fairly big effect on your life. Not being able to use a joint normally can also lead to loss of movement. It might not be able to move as far or as freely as normal, and sometimes it might give way because the muscles are too weak and the joint has become less stable. Exercise strengthens muscles and really helps to prevent this and to restore what was lost. Often these symptoms vary, and there's no clear reason. You can have good and bad spells depending on the weather, depending on your mood, depending on how active you've been. We don't know exactly what's causing the changes in the symptom. It's likely that it's a combination of things.
Knee osteoarthritis is associated with pain, and pain can result in people avoiding activity and exercises. This often results in muscle weakness. The less you do, the less you're able to do. But muscles are important for the joint and for the health of the joint. They stabilize it. They provide a hold around the joint that stops it from moving too much. And weaker muscles mean less stability around the joint. Pain often gets worse with less stability, and this can result in low mood, and this can cause further inactivity and further demotivation, and it goes round and round like this in a cycle. Inactivity and disuse are really unhelpful for the health of the knee joint. If you don't get load and weight and movement through the joint, through the cartilage, that cartilage degenerates quicker. It becomes softer and thinner. There's physical changes in the cartilage as a result of inactivity, and poor joint mechanics and flexibility as a result of that. So the aim of treatment is really to break this cycle. The very first treatment options that you can go for when you've been diagnosed with osteoarthritis, as we've said, is exercise. The second is weight loss. These two should happen together. You try to control the pain, you try to improve the function, the amount that you can do, and that should improve the quality of life. These therapies should always be attempted first, before any of the others. The pharmacological therapies like painkillers or injections, and the surgical remedies such as joint replacement. You can't overemphasize the benefits of a healthy lifestyle on the symptoms of osteoarthritis, particularly exercise and weight loss, also, and more generally, smoking. If you smoke, I'm sure you're very well aware of the many reasons to give up smoking. But since you're here to think about knee osteoarthritis, it will also benefit that. Smokers tend to have more pain and worse cartilage degeneration. If you want to help your knee and you want to try to give up smoking, there's a number here on the slide that you can call to help you with that. We know that weight loss has a massive effect on pain. Certain studies have showed that 10% weight loss is associated with a reduction of pain of about 50%. It's quite big when you consider that painkillers only reduce pain by about 25%. Even less than 10% weight loss has a benefit. The same study showed that 5% weight loss reduced pain by about 30% on average. Weight loss has also been shown to improve physical function and reduce the risks of many other chronic diseases. But there's a good way and a bad way to lose the weight. I think crash diets, and the evidence shows that crash diets would produce things like more fatigue, more muscle wasting, and less strength. And that's not so good if you have osteoarthritis of the knee. We're trying to improve the strength of your knee. If you need help to lose weight, then you can contact the number included in the presentation and also in the resources list on our website. Exercise can significantly benefit osteoarthritis and the symptoms from it. However, you've got to get it right. Not too much, not too little. If you get it right, there's also associated benefits in reduction in the risk of other health problems. It can decrease the risk of obesity and blood pressure, and diabetes and heart disease, stroke, Alzheimer's, generalized inflammation. But particularly about osteoarthritis, one exercise program in Australia studied a lot of people who were candidates for a total knee replacement. After they had an exercise program, 68 to 74% of those candidates with osteoarthritis didn't go on to have a knee replacement. So it reduces the risk of knee replacement. It also decreases pain, protects and nourishes the cartilage, and improves the strength around your knee, improves your balance, improves your bone density, and improves your confidence. That really leads on to positive benefits for your everyday activities, things that make life nice. If you're looking to start exercising, the best advice that I can give is to start now. Start slowly, start gently. If it hurts a little at first, you don't need to worry about that. But if it hurts for more than an hour, or if it's hurting the following day, or if the pain is excessive, then you need to reduce the amount that you're doing. Not stop, but certainly reduce. When you get it down to a manageable level, you can build that up slowly, over time, but systematically. So it's better to make a little gain over a longer period of time than to go straight in and try to get a big gain but take one step forward and 2 steps back. You don't want to keep overdoing it. We see this a lot in clinic, in physiotherapy, that people are so keen to get better that they can start off with their exercise program a little bit too aggressively. It doesn't generally result in a better outcome. We want people to be exercising regularly, but not excessively. So if you do that, you tend to get into what we call a boom and a bust cycle of doing too much, which causes more pain, and that causes a problem with the following day or two where you don't do much activity until the next good day when you feel okay again, you start and you really try and do loads of exercise, and then that leads to another bad day. This isn't the best way to start. Getting too enthusiastic with exercises often causes a layoff day. You can't exercise the following day because you're too sore from the day before. That might be okay the following day after that, and you try it again. But if you keep going with that pattern, over time, instead of getting stronger, people tend to get weaker because the time that they have to stop exercising means that their muscles deteriorate. And sadly, muscles deteriorate faster with inactivity than they increase with activity. So you have to go for a regular pattern of exercise. A regular exerciser might look a little bit like this if you put their time onto a graph. They can do a little bit on Monday and a little bit on Tuesday. They're still not sore by Wednesday, so that becomes a little bit more. And gradually you can start to increase the amount that you do. Probably over months rather than weeks or days. But still, you're looking for that graph of activity and strength and ability to go up. And hopefully, the graph of pain should be coming down at the same time. The best place to start is anywhere. Start with it slowly though. So for example, the exercise at the top, a squat. That doesn't have to be all the way to the floor. As you can see in the lady on the top left bubble, she's holding onto a chair, bending her knees just a little. That's a quarter squat. You can bend the knees a bit more, that's a half squat, and a bit more still, a 3/4 or a full squat, as you can see. The gentleman in the bottom left bubble is doing a sit to stand, so you can see that his knees are really bent, but he's got the help of a chair. So we don't have to start off with difficult exercises. There's always a way to modify them. Other useful things are standing, holding on, and bending the knee. We call this a standing knee bend. Or lying down, straightening the knee. Or lying on your back, bending the knee and pulling it a little to try to stretch the knee and improve the range of movement. These are all really useful and recommended by the Versus Arthritis campaign. If you're finding the previous exercises easy, these are options to improve the muscle strength and to make things a little bit more difficult for yourself, but make it better for your osteoarthritis. So a step up or a step down, getting on the static bike or on the pedals, or a variety of other things. You can see the link below and the link in our website for more examples of good exercises to try. So to sum up, osteoarthritis is commonly seen on x-rays of asymptomatic people with no pain, no problems. It doesn't always result in symptoms, and the symptoms can change. They can change over time. The first line of treatment, the first things you should do are start to exercise and lose weight if you need to. The exercise should be at the right intensity, at the right level, and it should be consistent. The avoidance of movement and the avoidance of exercise is much worse for both your physical and for your mental health. Now, these are the first line treatments. There are other things that we haven't covered as much in this presentation, things like corticosteroid injections and knee surgery, and they may be suitable for some people, but all people should really start with the sort of things that we're talking about in this particular presentation.
If at the end of this presentation you find that there's things that you want to review and go back to, you can watch it again. We have a website, you can see the address there, that you can click on that will give you the presentation, but not just that, also lots of links, resources, other organisations that you could contact to give you some more help, some information, some guidance about knee osteoarthritis.
If you go to the Swansea Bay Health Board physio website, you'll be able to see links to all of these places on the internet. There's advice from dietitians about how to eat and how to lose weight, particularly when you have arthritis. We have the exercises that we've talked through on a video on the Versus Arthritis campaign. And locally, you can get to Weight Watchers meetings through clicking on that link at the bottom, and various other things that we'll put on later.